Hello, my name is Lena Thompson, and in this video, I will share the steps and the processes that I went through having three brain aneurysms that ruptured. I will also show images and graphics throughout this video to show you what aneurysms look like, also what they look like after they have ruptured and after you've had surgery. Another portion of the video will discuss the different therapy options that can assist you with getting better. An aneurysm is an abnormal bulge or ballooning in the wall of the blood vessel that can burst and cause bleeding in the body. Aneurysms can develop in several different areas of the body. The body's main artery, called the aorta, can have an aneurysm that passes through the belly area, or it can also pass through the part of the aorta that passes through the chest. Blood vessels that send blood to your brain can also cause brain aneurysms, which are most common. Now, in the brain, that would be the Willis, which is a ring of arteries at the base of the brain. Some aneurysms may not cause any symptoms and may be discovered by chance during a medical exam or image testing. Some symptoms of the aneurysms may depend on their location, size, even pain, swelling, pulsating sensation, or vision problems. I myself had a lot of pain behind my eyes and did not know that it also contributed. But a ruptured aneurysm is a medical emergency that causes severe bleeding, shock, and in some cases, death. This is what a tiny brain aneurysm looks like, just a tiny bubble. Many people have them and do not know they have them. As I stated before, I had a lot of pain behind my eyes, and I contributed that to an illness called sarcoidosis. The pain with the aneurysms can be short lived or can last for severe hours. Now, there are two types of surgeries to have when fixing an aneurysm. Coiling of an aneurysm is one way, and this is also stenting. Placing a stent is another type of endovascular surgery that aims to prevent blood flow into the aneurysm to reduce the rupturing or bleeding. A stent is also a metal mesh tube that helps to keep the blood vessel open and support the coils. The coils are tiny, thin metal that they roll into a ball to stop the ballooning of the aneurysm. Coils are like soft platinum wires, and it causes it to clot. Now, when you have these procedures done, patients are given general anesthesia or sometimes sedated, depending, and they use a local anesthesia to numb you in the groin area. The surgeon would then make a small incision in the groin and insert a catheter, a thin, flexible like tube, into your femoral artery, which is a large blood vessel in your leg. The surgeon guides the catheter through the blood vessel using X-ray images until it reaches the aneurysm. At that time, the surgeon places a stent across the neck of the aneurysm, which is the narrow opening where it connects to the normal blood vessel. The stent acts as a scaffold to keep the coils in place and prevent them from slipping into the blood vessel. The surgeon inserts another catheter at that time through the stent and into the aneurysm, which releases one or more coils through the catheter, and the coils fill up the space and clot, causing blockage blood flow into the aneurysms. In the end, the surgeon removes the catheters and seals your incision in the groin area with stitches or a plug. At that time, patient is taken to intensive care for monitoring. Now, with the procedure, usually takes 1 to 3 hours, depending on the size and the location of the aneurysm. With myself, the first aneurysm ruptured, and I was in surgery while the second one ruptured. So I was actually in surgery well over 24 hours. After that, I was placed in intensive care and I was there for 2 weeks and then moved to a regular floor where I was for an additional 3 weeks. Now, I had two coils placed as well as a stent to repair the three aneurysms. It was a large process, but I'm happy to be here. And now the next phase of this would be the different therapies. Um, it's a long road of recovery when it comes to brain aneurysms, and you're really dealing with physical, mental, and emotional effects of ruptured brain aneurysms. The different types of therapies you will use would be physical therapy, occupational therapy, speech therapy as well, cognitive therapy, and psychological therapy. With those, there are inpatient rehabilitations you can use, as well as outpatient, home based rehabilitation, and even telerehabilitation. Now, the end of this video will show you real life images of my personal brain aneurysms and what I went through. Um, and I hope this video gives you insight on brain aneurysms and the different things you can do to help yourself. Thank you. Have a good day.